Welcome to ABC 24 This Week. I'm Richard Ransom. We are here every Sunday at 9 a.m. and 11 p.m. to bring you the real story behind the big stories, and we hope to accomplish that again today. Before I introduce my guests, here are our topics for this Sunday. First, the standoff pitting Blue Cross Blue Shield of Tennessee against Methodist Bonheur Healthcare. Between them, they care for thousands of Mid-Southerners, and now those many patients are discovering that care has been taken away or is about to be. How does this end? We'll also talk about how the capital cities of Nashville, Little Rock, and Jackson are gearing up for the legislative year ahead. Their governors already making waves in some instances with executive orders. And is a Memphis People's Convention necessary? Some activists say it is, to narrow down the field of black candidates running for mayor and make sure an African American is elected the next mayor in October. But not everyone agrees with that, which brings me to today's panel. Reverend Kenneth Whalen with New Olivet Worship Center here is against a People's Convention, and we're going to turn the floor over to you for a special Keeping It Real commentary later in the show. Looking forward to that, and we'll have some discussion as well about that. And Otis Sanford, of course, is here, my good friend and ABC 24 political analyst. So let's start with this kerfuffle between Blue Cross Blue Shield of Tennessee and Methodist Bonheur Healthcare. A big deal, really, in this community because Methodist Bonheur is one of the big ones. As we know, Baptists and Methodists pretty much rule this town when it comes to healthcare, especially with Bonheur being a part of Methodist and children's care, too. So let's go to start things off with a report from our Zaria Oates, who earlier this week showed you just the impact it's having, in this case, when it comes to doctors in our community. Yeah.
From mammograms to CAT scans, more and more services are becoming out of network for patients with Blue Cross Blue Shield, and radiology is getting hit hard.
Those patients who had been seeing us no longer could come see us. So we just sort of lost this percentage of people that we had a relationship with.
Not only are patients having to find new locations for imaging services, but transplant patients are also getting displaced.
Yes, we have already seen surgeries canceled. 25% of our liver transplants were Blue Cross patients. It's frustrating. Those patients now can't have routine lab work drawn at Methodist facilities.
But some patients are being cared for without an excess bill using the No Surprises Act. In effect in Tennessee for about a year now, the No Surprises Act prevents a provider from charging a patient the difference between what they charge and what the insurance company pays. But someone still has to foot the bill.
We still bill Blue Cross, but there's no set rate. They will basically pay us what they feel like they want to pay us, which is basically going to be a Medicare rate. We kind of just, don't get paid.
In a statement, Methodist said they're still negotiating with Blue Cross Blue Shield, but as of right now, they know employers like the city of Memphis and St. Jude have made special arrangements to remain in network for at least 30 days, pending the outcome of negotiations.
Our front desk people were having to field calls from Blue Cross patients and tell them, I know you've seen us for years and years, but at this point, we can't provide your services.
And once a patient does find a new doctor, the wait might be long.
They're already overwhelmed at Baptist Women's Hospital trying to get deliveries and procedures scheduled.
Both doctors have met with legislators in the past. They also plan to meet with more in the future to discuss new legislation to better protect both patients and doctors from any issues that come out of these insurance negotiations. In Memphis, I'm Zaria Oates.
So we heard the perspective from a couple of Methodist doctors as far as Blue Cross Blue Shield is concerned. They say they are still negotiating with Methodist in good faith. They do point out, they say, that Methodist wants to charge more for Blue Cross patients than the other insurance carriers that they cover. But nonetheless, this stalemate it's the people I'm thinking about here who are most affected by this. And you heard the doctors talk about it. We've also heard from some other patients who are in really life-threatening illnesses right now who are having to look at possibly changing doctors and hospitals very soon.
No question about it. Matter of fact, ABC 24 had another story earlier this week that focused on one of those patients who was really in a real bind. I think he had cancer treatments that he couldn't get done. This is just a terrible situation, especially at the beginning of the year. A lot of people are having to deal with their own health issues at this point, and to be told that they can't be seen by the people that they have been seeing for so long is a total disruption. And I would hate to think this is all about money, but it's all about money. And I just think that the public is being totally disturbed by this. If you're negotiating in good faith, then get something done because you need to get something done here.
Is anyone come out smelling good after this? I mean, I would think everybody is going to look at both parties being at fault here.
Well, I think that nobody smells good, nobody comes out looking good. I think that we, or you guys, the media, can come out looking pretty good by continuing to push the information to the public. But it's one of those harsh realities of life. I feel pretty sure the negotiations are going to come out, everything's going to work out fine, but what about those people who are caught in that 30-day window who needed those surgeries, who didn't get them? Finally, what comes to mind is what I've mentioned with you guys before: Methodist hospital system, Baptist hospital system. Those are religious, those are denominational terms. And it seems that with that being the case, there'd be some kind of way of dealing with this human element. But if it's about the money, then it really doesn't matter.
And it also raises the question in my mind about just how much share of this business Blue Cross Blue Shield has. It is a dominant insurance cover in the state, and so and when this happens, it disrupts a lot of lives as a result of that.
And speaking of following the money, Blue Cross Blue Shield and other huge mega corporations in the healthcare industry are big lobbyists, man.
Oh, yeah.
You follow the dollars.
They all are.
You
They
see who
all
has
got
the
money.
influence.
Yes, absolutely.
Yeah.
All right, we'll leave it there. We'll keep an eye on it, of course. When we come back, we're going to talk about some of the goings-on at the 3 state capitals in the Mid-South. Some governors are very anxious to use their executive pens, especially the one in Arkansas. We'll be right back.